Welcome back to the morning show on Tobago Updates. I am Adanna Combie, and of course, it is a beautiful Thursday morning here on the island of Tobago. It is 7:23 a.m. So if you are making your way to work or to school, you still have time to get there. Be safe on the nation's roads. Right in studio with us, we have Dr. Akeela Smith, and we are talking about Physiotherapy Month. We're celebrating the month of physiotherapy here in Trinidad and Tobago. And she's a physiotherapist, one at the Tobago Regional Health Authority. Good morning and welcome to the show.
Thank you very much. Thank you for having me.
Right, it's a pleasure to have you here. So we want to know, what exactly is physiotherapy?
Sure. Physiotherapy is really a healthcare profession that focuses on helping persons to reduce pain, to manage and restore their movement and physical function, especially when it's affected by an injury, a disease, a condition, or even disability. So we are really here as physiotherapists to help to promote movement and to restore persons' movement abilities.
Okay, and we are in the month of physiotherapy, celebrating physiotherapy. So what are some of the activities or some of the things that you have been doing this month, or you plan to do to celebrate or to commemorate this month?
Sure. So I must start to say that World Physiotherapy Day is celebrated on September the 8th, and it's really the opportunity for physiotherapists worldwide to shed some light on raising awareness and the critical role that they play in helping persons to move, to remain well, and to be independent. So this month, the Tobago Regional Health Authority would be having a symposium, and that would be tomorrow, Friday, the 29th of September. And this is our opportunity to shed some light on the global topic of arthritis and how it affects persons, and our role as physiotherapy in managing and helping persons to manage arthritis. As we understand that arthritis can be something very difficult sometimes to deal with, especially the symptoms, and it's not, a single condition, but engaging and informing the public about what it is, empowering them to understand how to manage it, is where we are going with this event.
I know a lot of people, especially in this part of the world where we live, arthritis is something that they experience a lot, and sometimes people suffer in silence, and primarily because they don't know that support is there for them. So I think this is a very beautiful initiative, and I do hope that people will come out, that people will participate in the event. They will come and they will get the information that will be shared and the how-tos. So how does one access services of a physiotherapist through the TRHA?
All right. So through the TRHA, once you have a concern or a problem related to pain or movement dysfunction, you must see a medical doctor within any one of the TRHA service facilities, whether it's your local health center or the general hospital. It's a referral-based system, so the doctor will provide a referral to you, and so you can bring that referral to the physiotherapy department, either located at Scarborough Health Center or Scarborough General Hospital, where you would obtain an appointment. So it's accessible through the referral of a medical doctor within any one of the TRHA facilities.
So like if you sustain an injury to any one of your limbs or anything like that, you see your doctor, then they refer you to the physiotherapist, where you do rehabilitation, is what I assume.
That's right.
To get you back to a good standard of living.
That's right.
And I know you spoke about arthritis being the theme or the focus this year. What are some of the other things people can access the services for in terms of rehabilitation? I know you mentioned injuries, but what else can people look to a physiotherapist for help and support with?
So I must highlight that most times, persons would access our services when they have an injury. But as physiotherapists, it's our professional duty and social responsibility to educate, to promote our profession, promote healthy lifestyle habits and prevention. And so some of these services outside of, accessing because of an injury is education, one. And there are other aspects of physiotherapy, because we treat people throughout their lifespan. So the very young, pediatric physiotherapy, children who may have problems moving and who have developmental delays. It may be a grandmother who would have had a stroke, good, and she has to be treated and go through a series of rehabilitative sessions with us. Wound care is also a part of physiotherapy, women's health. So there are a number of different services, all geared towards helping persons to manage pain and to move and maintain good movement function.
You said wound care. How does, if I sustain a wound, how does physiotherapy help me? Explain that to me a little
That's
bit
an
more. I'm
excellent
interested.
question.
I'm very interested in that.
All right, just to divert a little bit. So wound care is a specialist area in physiotherapy. So, you have to do additional studies for that. And oftentimes persons who have non-communicable diseases like diabetes, they are easily they sustain wounds very easily, and so they have difficulty with healing. And so it's very integral that a wound care specialist assists in managing the wound, cleaning the wound, and taking care of you on a regular basis. So that's one of the specialty areas in physiotherapy.
Oh, I would not have thought of that as physiotherapy at all. So the program is on tomorrow afternoon?
Tomorrow morning.
Morning. Okay.
It's going to be held at the Anne Mitchell Gift Auditorium at the Scarborough Library, starting at 9:30 to 2:30. Registration starts at 9 a.m. So this is open to the general public, and the information that is shared is not only from a management perspective related to physiotherapy only, but also medical management, because we are a part of the multidisciplinary team, and so it's very critical for us to work along with doctors, occupational therapists, dietitians, and so on. So persons can come and be assured that they are going to get information from licensed and qualified medical professionals in managing the symptoms associated with arthritis, because this is a chronic condition. And so empowering persons to be able to understand what the condition is about and how to manage their pain is critical towards helping them with self-management.
And the self-esteem also, because when you're in constant pain, sometimes you kind of question, when am I going to get rid of this pain? When will I be restored to full mobility and full use of my limbs and my,
Yes.
So I think it's a very good thing. And how is it open to the general public?
It is open to the general public. And so we asking persons to come out early as 9 o'clock to register. We are expecting to have about 200 persons, I believe, that can hold in the auditorium. So once you are there, you register. We also have in the afternoon time, consultations where you are able to speak one-on-one with the physiotherapist. Say, for example, you want to get more answers related to the condition and what your symptom profile is, we can guide you. It's a first come, first serve, it's limited spaces, so we are asking persons to
Don't
come
all
out,
rush at once,
register, and we will take care of you.
Right, that is excellent. That is excellent that you provide that as well. For someone who's listening this morning, right, and it's the first time they're hearing about physiotherapy, especially the younger ones who are trying to find career paths. Yeah. How does one become a physiotherapist? What are the steps you have to take? What is the channel you have to go through? How do we do this?
Wonderful. The requirements vary from country to country, but I'll stick to Trinidad and Tobago. Of course, upon completion of your CXC certification, most times if you are looking towards staying within the Caribbean, the only university is located in Jamaica, and that's the University of the West Indies Mona campus, where you can do physiotherapy at a bachelor's degree level and then move on to a master's degree. So it is a degree profession of 3 to 4 years. And once you have completed your studies, you apply and you are accepted into the program. When upon completion, you have to do an internship. An internship within the country once it's stipulated, and of course be licensed with the Physiotherapist Board of Trinidad and Tobago.
Right.
So that's the part you want to take. Sciences, you do your sciences, you pass your A-levels and O-levels, you apply to the university, and once you're successfully on the road to being a physiotherapist.
I love it. I love to hear it. And how has your journey been? You sound so passionate about this career path. How has your journey been, and how do you feel after, helping your clients to recover and to be rehabilitated to a better level of health?
Okay, I'll be a little bit biased here because with physiotherapy, it's quite a rewarding profession, and it has been very fulfilling to me being a athlete, somebody in sport who have sustained injuries in the past, and so it was very fascinating to know that I can return to the sport that I love and helping persons to return to the simple things that make them happy, going to the beach, playing with the grandchildren. It's very integral to play a role in that regard because movement is very important, and not only the physical benefits are there, but mentally helping them to feel like they are doing things that are meaningful to them and just uplifting their spirit. It's really a good thing to do and interact with persons in that way.
I'm sure it is. And I mean, this can affect anybody because you spoke about athletes, you spoke about the grandparents, you spoke about so many different, and earlier in your conversation, you spoke about infants who might have mobility challenges. So physiotherapy literally is very important in our daily lives because at the end of the day, anyone could sustain any measure of injury, anyone could fall ill, anyone could need to be restored to good health. So I commend you very much for taking seeing the importance in this field and for offering yourself to be a member of this prestigious industry as a provider, a practitioner to people in your society and stuff like that. And I just want to encourage people to come out tomorrow because I think that it will be of great benefit to them, as you mentioned, managing their health and managing issues that would arise. And for me, one of the most important things or the most commendable things is the one-on-one session, right? How many persons, I mean, I know you said it's limited or first come, first served, but how many persons do you think you'll be able to facilitate, or how long will you be there in the afternoon? Because the program ends at 2:30, you said, and then after that is when you have the one-on-ones. How long in the evening do you think you'll be there, or how many persons do you think you can accommodate?
All right, so actually to correct that, the session ends at 2:30. So in the morning, they would have a series of lectures, and following that at around 12, 1 o'clock, that's when the consultations will start. So you see the limited time that we have to work with. But of course, myself and other physiotherapists, qualified physiotherapists, will be there to speak to as many persons as possible. We are trying our best to facilitate as many persons. So I anticipate that, once we have a good turnout, which I know we would, it would go smoothly. Yeah?
I believe that there will be a good turnout as well, especially to our viewers who listen to us on a regular, and they're picking up the information and they will share, of course, the information with those who they care for and love. Because I know that in our communities, there are lots of people who we know and who we see are immobile or restricted in their movements because they just don't have the support. And even if they can't make it to the session tomorrow, someone can go on their behalf, gather the information, and help them in that kind of way to get back to a good level of movement. Is there anything else that you want to share with us this morning in relation either to physiotherapy, getting into the field, the session tomorrow, or any aspect at all of physiotherapy that you want to share with us?
I just want to encourage the general public that you don't have to live with arthritis in silence. It is a chronic condition, and so management is critical. As physiotherapists, we are part of the multidisciplinary team that work along with other healthcare professionals to help you to meet to your goals. And those goals may be simple. If it's to, go to the beach, if it's to play with the grandchildren, be able to walk from one street to the next in your village. We are here to help you. And pain, most times persons are afraid to move because they think it's going to be more painful. But movement is critical because if you don't move and you remain sedentary, it can cause more lifestyle conditions and diseases. So the encouragement is to come out, gather the information so you are empowered to self-manage and take care of yourself.
So well put. Thank you so much, Dr. Akeela Smith. She is a physiotherapist in the Tobago Regional Health Authority. And of course, the session is on tomorrow morning. So we're asking you to come out in your numbers and support. Thank you very much. Ladies and gentlemen, we are going to a quick break. And we are asking you to stay with us and also to share the live. Share the live. Share the live. We'll be back.